Assalamu alaikum. My name is Hamza Aziz. Rule number EP1770052. So today my topic of presentation is anticoagulant effect on rodents. Anticoagulant agents are the anticoagulant effect is a process by which blood stops to clot. This is process in which the process of bleeding is inhibited. Either it is internal bleeding or external bleeding. The process of bleeding is inhibited by the anticoagulant effect of several drugs. So these anticoagulant drug can be useful in many cardiac patients and many other disorders and syndromes. So in order to testify new drugs in variation and adapt variation in drugs and to adapt and to produce adaptability in the various anticoagulant drugs, first of all we have to check the effect of these drugs into the rodents or many other experimental animals. It may be guinea pig and rats, rabbit. So so the my topic is to explain the how can we discover the anticoagulant effect of drug into the rodents. So as I have mentioned that anticoagulant may be taken in the form of pills, tablets. There are various intravenous anticoagulant dosage forms which are used in hospitals. So in order to produce new anticoagulant drug, we have to testify it. So what are the material and methods to testify new anticoagulant drugs? So here I take example of some anticoagulant drugs, for example, promadiolene, diphenhydramine, difenoquam. These are some drugs which is about to testify on into the rodents. So we make their isomers in the form of trans isomer and cis isomer, and we are going to check the suppose that we are going to check the ability and efficacy of these drugs inside the animal body. Basically this is a sort of in vivo testing in animals. So these agents, the fact which comes to know that these agents work solely on the vitamin K. So they do some sort of changes in the vitamin K by which they can prove their mechanism as an anticoagulant drug. So first of all, our core objective is to give in that particular agent in its purest form in order to know its their efficacy. For example, if we are giving the above mentioned drugs or substances, so we have to give in these drugs in their we have to give these drugs into the rodents in its uh, purest form, which and the purity of the compound can easily be achievable by the several techniques, for example HPLC, TLC, and many other techniques by which we can easily aware of the purity and the efficacy of that particular drug. So so what are the prerequisite features of animals must be in which we can perform various uh, test of drugs. So animals should be of 8 to 10 week old. Rat should be considered as a specimen, and the weight of the rat is around the weight of the rat is around 175 to 200 gram, and it should be retained in the standard form of cage, and it should be received standard food and water. So and the temperature around the rat is also strictly maintained according to the guideline of the veterinary school. So these are some experimental protocols which scientist or any other member who is going to testify the anticoagulant effect should follow these rules. These are some sort of international guidelines. We have to provide such environment to animal in order to gain a valuable or precious information of anticoagulant drugs. So pharmacokinetic study means what uh, uh, mixture is going to give into the rat. For example, if we are going to give anticoagulant, so it should be dissolved in 10% dimethyl sulfoxide, 90% vegetable oil, and we should we should give these agents by force feeding to the rat. We may give these agents in the subcutaneous form, in subcutaneous dosage form, but we give these agents by force feeding. So after feeding these agents into the rat, we after some time we will going to check the anticoagulant effect of that particular drug into the animal body. What are the outcomes? Outcomes is that we get to know that the agents which we had just provided produced some sort of effect on vitamin K oxidoreductase activity, by which they can prove as an anticoagulant agent. That's why these agents can also previously used as rodenticides, because they act as an anticoagulant agent to that extent that they ultimately thin blood to very maximum extent, which will lead to the death of the rat. So by this research, it is got to know that these agents are anticoagulant, but it may be very lethal to animal. So from this research, it comes to know that these agents can be used as a rodenticides in several rat killing medicine vagara. So by this mechanism and by this method and material which I have just discussed earlier, we can easily able to know the anticoagulant effect of many other agents which may not be that much lethal for the animal, but we can know the effect of that particular drugs. So what is the procedure? Procedure is that in order to examine the anticoagulant effect of several drugs, we adopt a pricking mechanism, which is very simple. Take a reading of a bleeding time before administration of anticoagulant to the rat. Prick with the sterile lancet to the tail's vein, and by the blood which oozes out from tail's vein, by the help of that particular blood, perform a bleeding time. We can perform a bleeding time before giving anticoagulant agent, and we will also perform we will also perform bleeding time after giving anticoagulant agent. After the wait for 15 to 30 minutes, and by comparing these rates, we can easily know the effect of anticoagulant drug inside the body of rat or rodent. So the learning from procedure is that by observing the difference, by observing the extent of difference, by observing the how large the difference between the uh, uh, bleeding time before and after giving anticoagulant agent, we can easily predict the efficacy of that anticoagulant drug, which may be after some further test clinical trials come into the market, and it may be used for several patients. For example, there are many anticoagulant compounds in the market which have certain side effect. By the procedures I have just discussed earlier, we can get a compound which have much more less adverse effect as compared to the drugs which are today in the market. So by that particular research procedure onto the rats or rodents, we can adapt our medicine. We can produce several anticoagulant agents which may be more efficacious, and after several clinical trials, in vivo testing and in vitro testing, they will maybe used as a good therapeutic. Thank you. This is all from my side.